So I wear many hats. Obviously, I've been in the profession for 30 years. So from that point, I oversee many departments. I'm currently the director of the radiology department. I also oversee the physical therapy department, the cardiovascular services department, and the emergency room department right now, interim. So I wear many hats. My father drew me to my career path. As a young child, my father is in the radiology profession. He has since retired. I would go to work with him as a little boy. So he showed me the ropes. So as a 15-year-old boy, I was the tech aide. So I got a chance to appreciate what a technologist does and help the technologist. So from that point on, I had a huge understanding of what the expectations were for a radiology technologist. So then when I graduated high school, let me go into something that I know and felt comfortable in, and that was radiology technology. So obviously when you get to college, you have to study anatomy, there's physics involved, there's procedures of how to position patients. In high school, pretty much all the sciences and math. First things first, I would ask them, definitely can you get into anatomy? Because in radiology and/or healthcare, primarily is a hands-on profession. So, and you need to know the parts of the body. You need to be able to talk to people. You need to be sympathetic, because on the other end you have a patient that's sick, who's scared, who's hungry, who has no idea what's going to happen. You got to be able to talk to them, to comfort them down, let them know what to expect, because at the end of the day, they're very nervous. They do not understand or know what's going to happen, what results are going to be for their test. One thing that I would suggest to anybody that's looking to go into leadership, that you take advantage of public speaking. Because obviously it's not always what you know. You have to be able to associate and interact with people. So you don't have to know everything, but you need to know where to go to get the answers and how to be able to talk to people professionally, responsibly, and independently. So I get a chance to meet a lot of people, a lot of different personalities. There's a lot of diversity. I meet a lot of folks, whether they're rich, they're poor, and I get a chance to interact and share stories, share ideas. I get an opportunity to train students, tell them about what my career path was, how I learned, and what to expect. So I enjoy that very much. I enjoy talking to people, I enjoy training people, educating them, but most importantly, I enjoy motivating people. The motivation comes from watching somebody be successful. We deal with a lot of stressful situations and scenarios. There's nothing more rewarding than getting the proper picture so a doctor can give a great diagnosis for a patient. So I want to motivate people to know that, hey, we're going to be encompassing in some tough times, but at the end of the day, when you come out and you're successful, there's nothing more rewarding than that. So obviously I'm very partial to radiology. Speaking of technology, radiology is always, they have the finest tools. We always say we have the most expensive tools. We get to do CAT scan, we get to do breast MRIs, we get to do MRIs, we get to do nuclear medicine, we get to do ultrasound. So as I tell my children, it's like an octopus. And then you get to expand into different modalities. You're not just, I don't want to say stuck, but you're not just doing strictly diagnostic x-rays. You get an opportunity to move into different modalities, to see different things. So the opportunities to grow are there for radiology. I'm an employee, doing this for 30 years. I don't have all the certificates that they require. I don't have a doctorate. I don't have a PhD. I don't have master's. I have an associate's. At the end of the day, that piece of paper doesn't necessarily mean that you're the most qualified. You need to be able to interact with people, as I said earlier. But the motivation comes from watching somebody be successful. I enjoy helping people. People come to the hospital sometimes at their weakest moments. As I said, I want to motivate them. I want them to feel good. I love the feel-good story. I love coaching. I love motivating. So yes, my story is people come to see me at their weakest times, and I'm hoping that they get an opportunity to leave a little bit higher than where they came in at. This machine is a CAT scan. It's a 64 slice CAT scanner. So with here we can take images of the whole body. It's state of the art. It's one of the newest pieces of equipment that we have. Costs over $300,000. Expensive toys.
Very expensive toys. Well, thank you so much for joining us, and appreciate being here at Lower Bucks Hospital.
Thank you.